Hey guys, what's going on? This is Colin Zhu, aka TheChefDoc, and I am here again in Orlando at the Lifestyle Medicine 2022. Wouldn't it be interesting if we can grab random lifestyle medicine practitioners, providers, healthcare professionals, and just ask them, what does lifestyle medicine mean to them? What does it mean in their own life? And what does it mean to their community that they serve? Let's find out.
So hey guys, this is Dr. Colin Zhu, aka TheChefDoc, and we are in Orlando, Florida. Okay, we're at the Lifestyle Medicine 2022, and I have these two lovely, lovely people. And why should patients, people that are watching, why should they care about lifestyle medicine and what it offers?
Because it works.
Yeah, right.
Like, I feel like that's amazing. Like, it works really well. You just have to do it. You just have to be diligent about it for a little bit, and you just start feeling incredible, and then you want to stick with it.
Yes, patients feel so much better. I've never had patients, when I give them a medication, tell me that they feel so much better. And this is the one thing that I teach them how to change their diet and exercise more. And I mean, I had a 60-year-old gentleman say, I wish I would have learned about this 20 years ago. So patients just feel so much better, and there's absolutely no side effects, just benefits.
Because we have so many patients who don't feel they have control over their health or their health outcomes. And you have so much control. I got into this because my mom had breast cancer young. And I was like, how do I prevent breast cancer in myself? And doing things like exercising every day, eating healthfully. I've lowered my risk. I now am 12 years after she was diagnosed with breast cancer. And I feel so much better and healthier and confident that even if I got breast cancer, which I don't think I will at this point, my chances of survival are so much improved with my lifestyle.
I think because lifestyle medicine is a tool that you can use to help your patients really live their best life and optimize their health. And I've had so many patients that have been able to come off medications for diabetes, improve their blood pressure, whereby we're able to cut back on their medications, lose weight. And it's not expensive. It's not expensive to, go outside and walk. It's not expensive to, eat more vegetables, especially if you're going to the farmer's market or discount grocery stores. And it really is something that patients want, but they just don't know that it's available. People don't necessarily want to be taking a lot of medications. They don't want to feel tired. And a lot of medications do make people feel tired, or they do have side effects, and they may not necessarily discuss that with their doctor. So I find that patients are always very appreciative that I'm open to other modalities instead of what people say is, oh, you don't just push drugs. That's what patients literally will say. So they do appreciate it. So I think that any healthcare provider should incorporate lifestyle medicine into their practice if they want to really help patients to live their healthiest life.
I mean, 100%. I totally agree with Judy. It's one thing there's the individual health component where, all of the pillars of lifestyle medicine in some way or the other are connected to, decreased death in terms of, COVID, for example. I think that the past few years have really demonstrated that, excess weight, high cholesterol, high blood pressure in particular has really been connected to COVID death. But besides that, it's about living a full life. And I think for each patient who comes through my door, they want to know how to do lifestyle. Lifestyle is the first line of treatment for the majority of chronic diseases that we treat in medicine. It's the first line of treatment for the majority of chronic diseases that are responsible for 80% of deaths that, are...
It's huge.
Yeah, and so, but nobody knows how to use it. But lifestyle medicine physicians do, and and all of the lifestyle medicine, disciplines do. OT, PT, health coaching, and so we need to spread the good word about lifestyle medicine so that people can have access to this. My patients feel that way too. They come in and they say, thank you for giving me care that aligns with my values and my goals, because it's not a lisinopril deficiency. It's not
a Prozac deficiency.
It's not a Prozac.
Or statin deficiency, right?
Yeah, it's not. I think somebody said congenital stent deficiency. It's not right. We have to but there is a lifestyle deficiency. That's something we can't live without. Our daily lives are deeply intertwined with lifestyle, and the treatment is healthy lifestyle for the majority of our chronic conditions.
Women are starting to have more chronic disease. So when I was following them early, obviously they were pregnant, but eventually they continue being in your practice and they start having a problem with weight and then chronic disease. I would return them to their primary care physician. They would come back being on medication. And I know that the 80% of our problem is related to lifestyle. And I knew what to do. At least at the time, I knew the exercise component. But eventually when I joined the American College of Lifestyle Medicine and I've learned how much the whole plant-based diet was important, so I was able to reverse and help a lot of my women in order to not being on medication, but also to help them into stages of life that are related to irregular cycle or menopause that are often due to a little bit too much fat, too much estrogen, and then we can change that with a proper diet and the exercise, another component of the pillar.
Well, I think most patients, so first of all, so many people aren't even aware of how much diet can affect their health, right? So they are just eating what's available, what's around, what they grew up with based on taste and convenience and cost and everything else. So most of the patients don't really understand the importance of food and where their food comes from and how that affects their health. And I think that what I love being able to teach them and inform them is the power of the food to really treat inflammation, improve insulin sensitivity, and the antioxidants from fruits and vegetables and fiber and the benefit on the immune system. So all of it, right? Because we see in fertility, so many patients come in and they ask what supplements they should be on. What are the supplements? What are the vitamins? And they want a pill and they want to get pregnant and they want to do it fast. And I really, am one of the few people, more and more all the time, but especially in fertility, that take the time to really say, hey, let's look at your diet. Let's talk about how you might be able to boost your health and your fertility by adding more antioxidants, adding more fiber, adding more fruits and vegetables and whole grains to your diet and supplementing. And I've seen great effects. Amazing. So much better natural fertility. If they're doing IVF, they make better embryos. It's amazing.
And for lay people, for patients, for others out there, I think it's just critical to know where is the evidence base that allows you to treat yourself and engage in your healthcare the best outside of just taking medicine. So rather than just a pill for every ill, what can you do to take control of your health?